So guys, for the requirement for this procedure, we will need a tray, and inside that tray we will have a bowl containing cotton wool swab and also some guards. We will also need a gallipot containing sodium bicarbonate. This is to remove crust. Then we also need another gallipot containing water. We will need a kidney dish with safety pins, but we do not have safety pin. That's why we are improvising for office pins. We'll also need an adhesive plaster and a pair of scissors. We will need a receiver containing nasal catheter also, as you can see. Another receiver for use swab. A no smoking label should be there. And of course, our oxygen cylinder, which has a humidifier. And yeah, we do not need a tubing, but if you need a tubing, fine, you can get one for yourself according to your school requirements. So guys, for the procedure proper, we have to explain procedure to patients, tell them why they will be needing this oxygen and how it can benefit them. Then you gain consent from the patient before you bring your instrument to patient's bedside. Then you screen the bed also. You pour some of the sodium bicarbonate in a gallipot. Then you clean the nostrils with cotton wool swab held in a pair of nasal forceps. Guys, please forgive us for not using a nasal forceps. We couldn't get one. So, but try as much as possible to get a nasal forceps. I will leave the picture on the screen so that you can see. So the next thing to do is to connect, open and test for patency of the catheter with water, so that it will also blow off some dust. So as you can see, we connected the nasal catheter. You can see where we connected it, and this blue place I'm opening is where to on the oxygen. This green place is to regulate the flow of oxygen. So you are going to regulate the flow of oxygen to 4 to 6 liters per minute for an adult, but for an infant it is 1 to 3 liters. So you are going to dip the end of the catheter in water to lubricate. Then you gently insert well into the patient's nostril. Is going to be 5 to 7 centimeter deep. So you're going to, for this type of catheter, you have to put it in the nostrils, then turn it towards the back of the patient's head, as you can see we are doing. Make sure to strap it so that it's going to be a little bit tight and it will not pull off. As you can see here, we have already used the adhesive tape to strap the nasal catheter to the cheek. Then we are also using an office pin. You're supposed to use a safety pin, but because we do not have a safety pin, that is why we used an office pin to strap it to the pillow, so that if patient is rolling and stuff, it is not going to pull out easily, because difficulty in breathing, which is dyspnea, can be very, very terrible sometimes. And you may find patients even trying to roll on the bed and stuff. So these pins are for it not to pull out, even the adhesive tape which we used on the cheek. You should take note of is that oxygen administration is administered intermittently and not continuous. What I'm trying to say is you should put oxygen, and after like an hour you remove it, check if patient's condition has improved before you can know if you want to put it back or not. Patient's condition will determine if oxygen administration will continue or not. Guys, if you've watched to this point, leave a thumbs up and make sure to subscribe to this channel.